Assalamu alaikum. My name is Aniza Sohail and my roll number is 6012 and my topic of presentation is cognitive communication disorder. What is cognitive communication disorder? Definition. Cognitive communication disorders are problems with communication that have an underlying cause in a cognitive deficit rather than a primary language or speech deficit. Cognitive deficit basically an inclusive term used to describe impairment in individual mental processes that lead to the acquisition of information and knowledge and drive how an individual understands and acts in the world. The following areas constitute domains of cognitive functioning, attention, and decision making. A cognitive communication disorder results from impaired functioning of one or more cognitive processes include the following: 1. Orientation, language, processing speed, problem solving, reasoning, executive functioning, and metacognition. First, orientation. Orientation include knowing where, when, and who you are, as well as why you are there. Language, word for communication, processing speed, quick thinking and understanding, problem solving, finding solution to obstacles, reasoning, logically thinking through situation, executive functioning, making a plan, acting it out, evaluating success, and adjusting. And metacognition, thinking about how you think. Cognitive communication disorder. A person with cognitive communication disorder may have difficulty paying attention to a conversation, staying on topic, remembering information, responding accurately, and understanding jokes or metaphors or following directions. Cognitive communication disorder vary in severity. Someone with a mild deficit may simply have difficulty concentrating in a loud environment, whereas a person with a more severe impairment may be unable to communicate at all. What cause cognitive communication disorders? Since cognitive processes are controlled by many cortical and subcortical structures within the brain, any damage to the brain can cause a cognitive communication disorder. Cognitive communication disorder also result from a traumatic brain injury, a brain infection, a brain tumor, or degenerative disease such as multiple sclerosis, Parkinson's disease, Alzheimer's disease, or another form of dementia. How cognitive communication disorders are identified. Anyone who has suffered a brain injury or stroke should be screened for cognitive and perceptual disorder. Cognitive communication disorder can be identified using the cognitive communication checklist for acquired brain injury, a free online screening tool. Once cognitive communication disorder are identified, a referral should be made to speech language pathologist for a full assessment. An assessment is likely to include several tools, both formal and informal, including some of the following: Montreal Cognitive Assessment, Scale of Cognitive Ability for Traumatic Brain Injury, Cognitive Linguistic Quick Test, Functional Assessment of Verbal Reasoning and Executive Strategies, Assessment of Language-Related Functional Activities. After assessing the client, the speech language pathologist prepare a personalized treatment plan targeting goal to meet the client functional needs. Treating cognitive communication disorder. People with cognitive communication disorder often benefit from assessment and personalized treatment by a speech language pathologist since each case is unique. Therapy may include a combination of techniques. The three main goals are to restore function, compensate for deficit, and educate the client and family about the disorder and its treatment. 3 points are remediate, compensate, and educate. Remediate includes using exercise or software to retrain discrete cognitive processes such as attention, using internal memory strategy or speed retrieval training to solidify memories, completing practice tasks that are difficult while offering support to build independence. Compensate includes using external strategies for improving memory, for example memory books, smartphone apps, teaching strategy for approaching problems to strengthen executive functioning, for example plan, do, review, establishing routines and schedules. Educate include using video or audio recording to make the client and his or her family aware of what the deficit looks and sound like, discussing the assessment result when the client and his or her family, problem solving around error as they occur, providing group therapy for the client and his or her family, including a discussion of the client deficit and group practice of the treatment strategies, teaching family members and caregivers to recognize and help the client overcome his or her deficit. That's all. If you have any question, ask me in my inbox. Thank you.